How does COVID-19 compare with the flu? There's new data tonight from the Ontario Medical Association.
Their information gained from more than 400,000 hospital admissions during the pandemic. Our health reporter Pauline Chan has the details.
The study looked at data from some 30 hospitals and compared COVID-19 with influenza, showing that COVID is indeed more severe than the flu. In fact, the researchers found COVID-19 had 3.5 times the rate of mortality compared to the flu. It also showed patients had a 1.5 times greater need for intensive care, and hospital stays were 1.5 times longer. They also debunked the myth that young people are not severely affected by the novel coronavirus. While mortality was higher in older Ontarians, figures showed intensive care admission and unexpected readmissions after discharge were extremely high in adults under age 50.
It is clearly an illness that can be quite severe in younger people. We don't understand yet from a health system and from a physician level why one individual gets really sick and another doesn't.
Dr. Amol Verma says the second wave was largely driven by that younger demographic.
It's people who are in their 40s and 50s in intensive care units on ventilators.
Both doctors from St. Mike's cited patients who got ill in the first wave and returned repeatedly to hospital, only to die several months later from lingering health problems. And the OMA had a warning about the coming weeks.
We are at risk of having a third wave.
We scientifically expect from our modeling that the UK variant will become the dominant strain in the next month.
The good news is that the vaccine can be fine-tuned if it proves to be less effective against the new variants. And standard practices such as wearing a mask, washing your hands, and keeping your distance are effective against all strains. Pauline Chan, CTV News.